1 in 7 women in Australia will be diagnosed over their lifetime, with 58 people diagnosed each day on average. The research also indicates the mortality rate is falling. Professor of Public Health at the University of Sydney, Naeemat Husami, says the higher rates are due to several factors.
Well, there are two things that we look at, Melissa, when we try and determine the burden imposed by breast cancer. One is the incidence rate, which is the number of new cases diagnosed. And Australia is sitting right at the top alongside New Zealand as far as incidence rates for breast cancer, but only just slightly so above other affluent countries like the US and many European countries with developed health systems. On the other hand, as far as breast cancer mortality rates, Australia is actually doing quite well. We have, over the last 10 years, in fact, even over the last few decades, have managed to reduce breast cancer death rates. And in the current study, which focused on the last 10 years, we show that breast cancer death rates have continued to decline in Australia. So we're doing well as far as breast cancer outcomes. Unfortunately, when we look at the rest of the world, the outcomes in terms of breast cancer death rates vary between countries, with many countries simply not achieving that reduction in breast cancer mortality rate.
What is contributing to that change in mortality rate here in Australia?
In Australia, we're really fortunate to be living in a fairly developed health system, and the declines in breast cancer death rates we have observed, not just over the last decades, but going over the last 3 to 4 decades, has come from a combination of improved diagnosis and also the availability of population-based early detection with mammography screening. But very important to consider also the effect of improved breast cancer treatment, improvements in how we manage breast cancer surgically with radiation, and massive advances in breast cancer systemic treatments, chemotherapy, biological treatments that have really improved breast cancer outcomes, especially in the last 20, 30 years.
Yeah, is there a correlation here, do you think, between the testing rates here in Australia and that high rate of diagnosis? Do we have more incidence of breast cancer here because we test more?
But the fact that we test more and we do population-wide screening for breast cancer is definitely contributing to that increase in incidence rates. But we have to bear in mind that that has been a really effective strategy to then reduce the likelihood of dying from breast cancer. And also, there are other bigger drivers of that increase in incidence rates in breast cancer in Australia. And these include the fact that we're living longer, so we have an aging population. And breast cancer is far more common in older age. So that's part of the reason we have a higher incidence rate. Other factors relate to breast cancer risk and the background risk in the population. What I mean by that is the various things that determine a woman's risk of breast cancer include complex issues such as family history, getting older. But there are other drivers of breast cancer risk that are linked to our contemporary lifestyle in affluent societies. So we see this high incidence rate, not just in Australia and New Zealand, but similarly in more developed nations, the US, France, Japan, and many of the European nations. These risk factors that I'm referring to are not just the ones that the public seems to be aware of, like genetics and family history, but lifestyle-related factors that correlate with, having an affluent sort of society and being in fairly high-income countries, which we are in. And they are things such as having children later, and having maybe too much alcohol as part of our lifestyle, how we eat, and the fact that we have high rates of being overweight and being obese. We know that being overweight and obese in late adult life and postmenopausally is a really strong risk factor for breast cancer, and low physical activity. So these are risk factors for breast cancer and, in fact, other cancers that are all contributing to this background risk in the population. And it's important that, we speak about these risk factors so that women understand the many factors that determine their risk of breast cancer and are therefore contributing to that sustained increase in breast cancer incidence in Australia and in other developed nations.